Hi friends, good evening. I'm Dr. Ashutosh Gupta. Today we're going to talk about a congenital heart disease which can be very well missed. Okay, so many times what we've identified is this that this congenital abnormality can be adjusted as a normal four chamber view, right? So if we tweak in, or probably if we do an extended fetal echocardiography, or probably we miss on to some subtle findings, we might even miss the complete diagnosis. First is this thing. Second is this that probably whenever we are doing the ultrasound, because I'm a geneticist, so it is all imperative to ask about the background history. So for which the patient might not be that forthcoming, they might be reluctant to come across with their family history, but which is very important, and it was pertinent in this case. Okay, so let us first discuss this case, and then probably we'll talk about both these things together. That what this diagnosis is all about, and how the family history can make a huge lot of a difference, and how do we counsel the patient. This is this kind that we are doing. So this is for our understanding. I have made it as a from a basal four chamber view, so that we can very well establish this a subaortic VSD. Right. So look closely, and what we can identify is a subaortic VSD. So this is the subaortic VSD, and then what we can identify that if you try to look around, initially the four chamber view can be absolutely normal if you are into a lateral four chamber view, right? And since it is a basal, so we were not very happy with this thing, and therefore we identified that this is subaortic VSD. Secondly, we identify that the pulmonary trunk is absolutely normal. The division to the both the RP and the LP is also normal. And then, but you see that the aortic root is dilated and the arch of aorta is slightly dilated, right? So this is the dilatation. So, and then probably we try to look around why is it dilated, and therefore we try to see that there is an aortic override, meaning thereby that the RV is also contributing to the aorta. And usually the RV-LV ratio is 60-40, but in our case it is slightly reversed, so meaning thereby that we are seeing that RV could be slightly small. So that is how it is. So the diagnosis is a pink variety of a tetralogy of Fallot, right? And the third variant is a pulmonary artery stenosis, and the fourth element is right ventricular hypertrophy. So the RVH is directly proportional to the element of the pulmonary stenosis or atresia, right? So here it is a lateral four chamber view, and this is the subaortic VSD. And then we try to look around the aortic override, so probably we would be in a position to identify that this is the pulmonary trunk and the division, and the RPA LPA looks up. Yes, this aortic, this is the aortic override, right? So that is how it is. So it is a pink variety of a top, and this can be missed. And so this is the top could be a blue or a pink variety, and pink is this that the baby would not be that deoxygenated, and blue would be deoxygenated or a cyanotic trough, right? And we try to look around for the thymus, so we cannot identify thymus also. There is an old dictum regarding the tetralogy of Fallot is this that the four chamber view can be normal in in TOF, and the diagnosis of the TOF, they have been missed in the past also, they are being missed now also, and in the future also. We if we are not very sort of an pertinent to see that particular this thing, or depends upon the position of the baby, it might be missed. Pehla. Dusra, this is a conotruncal malformation, so could be associated with 22q malformation. So this was a third pregnancy of this lady, and she have had some issues. First pregnancy was a twins, and therefore we had a preterm labor and all those stuff. But the second pregnancy was very pertinent. That the baby had a sort of an infective etiology only for one particular day, and then the baby sort of an because of the infective etiology, the baby they were not able to make any diagnosis at 5 months, and therefore we lost that baby, right, with an illness of only one day, right? So that can be identified or could be looked around by only by an immunodeficiency. So in 22q microdeletion, what happens is this that we can have a penia for everything. So we can have an sort of an anemia, we can have an immunodeficiency, we can have an hypocalcemia. Since the thymus is also deficient, so meaning thereby that the immunity of the baby is also on a venous side, right? And so that is so immunodeficiency syndromes and 22q microdeletion, they go hand in hand. right? So that is how it is. So what we have known is this: the 22q could be a de novo in 95% of the cases, but in 5% what we've identified is this, that the mother could be a carrier, so she can be a silent carrier. And because of the variable sort of an penetrance to the offspring, so the offspring could be affected to a severe variety, right? And so meaning thereby that doing the amniocentesis to this baby with the TOF and with the family history makes all the difference, that probably we identify the 22q microdeletion to this baby. Secondly, we can even offer this sort of an array to the mother also, so as to identify if she or the either of the parent could be carrier for this 22q microdeletion. So that can happen in 5% of the cases, that they can be a silent carrier for this 22q deletion, and they might be on the milder side, sort of an manifesting for this 22q, right? So the take home message is this, that just off in four chamber view they can be absolutely normal until unless you are there into an basal four chamber view and looking around for the subaortic VSD. So four chamber views can be absolutely normal. Pehla. That usually happens with the pink variety of a top, not with the blue variety. And the top, the diagnosis of the top, they had been missed earlier also. They would be missed because outrightly four chamber view can be absolutely normal. Secondly, there could be familial occurrence of this 22q microdeletions. So 5% either of the parents could be carrier, and therefore they can manifest their offsprings with a severe variety. You're right. Thank you very much for your patience.